Our next topic is measuring the effects of vaping on the lungs. So I'm going to introduce our speaker. And Sanja, I practice, so I hope I get this right. So our next speaker is Dr. Sanja Stanojevic. She is an assistant professor in the Department of Community Health and Epidemiology at Dalhousie University. She is a respiratory epidemiologist with expertise in methodologies to characterize the normal growth and development of the lungs. She chairs the ERS Global Lung Function Initiative Network and is vice chair of the ATS Pulmonary Function Testing Proficiency Standards Committee. She recently co-chaired the ERS ATS standard for pulmonary function test interpretation. Welcome, Sanja.
Thank you so much, Barb. Thank you, everybody. Good morning. Such a pleasure to be able to present here today. And I just need to figure out Zoom. There we go. So I'll start with, I received funding from some organizations unrelated to this work, so I want to be transparent. But I think most importantly, I am a respiratory epidemiologist, as you heard in the introduction. My research is focused on how the lungs work and how we can keep people's lungs healthier for longer. And so I have an implicit bias when I think about the effects of vaping on the lungs, because anything that our lungs are exposed to is potentially detrimental. So I want to outline today's session. We're going to talk about what we know about the effects of vaping of the lungs. I'm going to be very transparent and honest and tell you about the challenges we've experienced in conducting studies about vaping. And I'm excited to present some unpublished preliminary results, just as a bit of a teaser to let you know about what's to come and what we might expect in future studies. So there's no question about it. There's no doubt whatsoever that we are in a new epidemic of youth vaping. These are data presented from 2020, a national survey of tobacco, alcohol, and drugs in youth and young adults. And you can see that since the early 2000s, we've seen quite a stark increase in the number of young people that are vaping. Last week, the 2022 report was published, and you wouldn't be surprised to know that the rates are increasing even more than what's presented here on these slides. But what I find very striking is when we engage with community. So we've talked to a number of high school students, young adults here at university, and every single one of us has told me, your numbers are wrong. Everyone in my high school vapes. And so while we have these surveys and we can certainly see the trends, from what I hear about from high school students is that we're grossly underestimating the number of children and adolescents that are exposed to vaping products. And we really need to move fast to understand the effects of vaping. So I have to be honest, everybody was taken a bit by surprise. E-cigarettes or vaping was introduced in the early 2000s. And as respiratory scientists, not many of us paid a lot of attention to it. And in the last 5 to 10 years, what we've seen is this exponential rise in the use of vaping, particularly in young adults. And we see this because vaping is promoted through social media. It's seen as socially acceptable. There is this ingrained perception that it's safer than smoking. And there isn't the same public health messaging and evidence that we have for smoking. And as a result, it's really picked up. Youth are using it as a coping mechanism. They're using it and they recognize that they're addicted to these substances. And we really have a lot of trouble enforcing. It's great to see New Brunswick taking the charge and leading to advocate for increasing the age at which tobacco products, including vaping products, are sold. And I think we collectively need to do a lot more to raise awareness about vaping. So before we go into the future, I think we have to be cognizant of the past. We have decades of research into tobacco cigarette smoke. And I want to just talk about that past very briefly so that we can contextualize what's happening today. Tobacco cigarettes in themselves contain more than 600 ingredients. They, when combusted, create chemicals that are difficult to measure. And we know there are at least 69 carcinogens in tobacco cigarettes. Collectively, as a community around the world, we have done such phenomenal work to reduce the rates of smoking and to increase awareness that we nearly had a generation that wouldn't have even thought about picking up a cigarette. And the evidence that we've generated about tobacco cigarettes took us a long time. So this is some conceptual work showing that the effects of tobacco cigarette smoke, particularly lung cancer, deaths from smoking, some of the more measurable health outcomes, lagged by at least 20 years. And so, in my opinion, we can't wait until we see the long-term effects. We can't wait to see if people will develop lung cancer or if vaping will cause them to die earlier. We need to start thinking about how we use the evidence we have today to inform our policies and education materials. And so the lungs are so resilient to our exposures that this 20-year lag really influences how we can do research. I also want to highlight this very historical perspective that the very first study that showed an association between the exposure with tobacco cigarettes and lung cancer was published in 1939. And for us that have been around, knowing that it wasn't until the 60s that major health organizations like the Centers for Disease Control, the Surgeon General in the US, the British Medical Association, wasn't until the 60s that those organizations started to recognize and acknowledge this evidence. And we know that it wasn't until the early 2000s that we started limiting where people can be exposed to these to tobacco cigarettes. And so even though this evidence existed in the 1940s, early 1940s, it took a really long time for those policies. And again, I want to emphasize that I don't think we should wait or can wait for the same level of time or the evidence for tobacco cigarettes. And many people say that vaping is safer than smoking. Well, smoking kills 6 million people every year. Anything is safer than smoking. And so we need to be cognizant that 6 million deaths today is still too many, and we shouldn't be promoting or allowing for products that kill anyone, let alone fewer than 6 million. So what are e-cigarettes? As I mentioned, they were first developed in the early 2000s, and actually out of a good place. It was a scientist in South Korea. His father had died of lung cancer, and he was interested in developing a product that removed the tobacco combustion. He wanted to remove the harmful effects of smoking. He recognized that people get addicted to the nicotine in cigarettes, and so this was a very innovative way to deliver nicotine to the blood system without the need for combusting tobacco cigarettes. And it was designed as a smoking cessation device. It was not designed as we see e-cigarettes today, and it actually came from a good place. I also want to recognize that there is evidence. This is evidence from a large meta-analysis of nearly 2,000, well, just over 2,000 people. A meta-analysis is where we take evidence from multiple studies. In this case, they took 6 studies, and we put it together to look more holistically at the totality of evidence that exists. And what we can see is that for people who smoke, there is evidence that e-cigarettes can help them stop smoking. So again, unequivocal in people who are already smoking, there is potential benefit of switching to e-cigarettes, which is very different than saying that e-cigarettes are safe and that people who don't smoke should think about starting. And if e-cigarettes are really designed for smoking cessation, and if they're designed to help people remove the harmful effects of tobacco smoke, then I ask you who these ads are targeted. Certainly not the smokers who tend to be older. When we look at the types of advertising that exists, pardon my poor resolution, these are all from social media. We know that the targeting of e-cigarette products is to young people. Now, the real question is vaping safer than smoking? So what do we know so far? And sorry, I'll go back. The statement that people say is that vaping is safer than smoking, but I think the question really is vaping safer than smoking? And this is where we can look at the evidence that exists so far. So a few years ago, there was a beautiful review that went straight from the cellular right to the lungs and clinical endpoints. And Dr. Gotts and his colleagues that looked at the evidence and reviewed all of the studies that have been published looking at e-cigarettes said that there are measurable adverse biological effects of e-cigarettes on the cellular health in humans. And this has been demonstrated both in animal studies where animals are exposed to e-cigarettes and then we look at their cells, but also to human tissue. So these are human tissues that are cells derived in culture, but also cells that are taken from humans through samples of the lungs and biopsies and so forth. And so there is measurable evidence today that e-cigarettes do harm the cells and structure of the lungs. The chemicals that are included in e-cigarettes, there are more than 7,000 e-flavored chemicals that are out there on the market today. It's very difficult to study each individual component of e-cigarettes. And what we know from aerosol science is that when you aerosolize the liquids, those chemicals combine and react in ways both in that those aerosols in the device, but also in the lungs, creating many more chemicals. And it's very difficult to study which one of those chemicals in particular might have harmful effects. We also know there were some studies done here at Dalhousie when the metal coils inside e-cigarettes are heated. They release tiny nanoparticles of the metals that are contained. And those metals have been demonstrated to deposit into our small airways. And the way our airways work, our lungs work, is that as we get into those teeny tiny airways, the airways that are right at the distal end that are participate in air exchange at the alveoli, those small airways are extremely sensitive to irritants like these chemicals and the metals, and they cause inflammation of these small airways. Repeated inflammation causes scarring, and with enough scarring, those airways will close. So from these cellular studies, we know that exposure to vaping causes inflammation. So on the left-hand side of the graph, as I said, repeated inflammation. You can think these very small airways, if they keep getting red and inflamed and closing, it causes scar tissues. And the more times that happens, the more susceptible and vulnerable our lungs are to infections and other problems. It causes a weakening of the immune response. So what we see is an influx of immune a cytokine storm response into the lungs. And again, repeatedly exposing our lungs to that does weaken the immune system overall. We saw with COVID-19 that people who smoke and vape were at increased risk of negative sequelae due to those infections. And what I think is important, what with links to the research that I'm doing, is that we see that there's actual destruction and damage to the alveoli, or the air sacs in the lungs as well, which directly influences the way our lungs work and our ability to breathe. And so, as I mentioned at the beginning, we were all taken aback by the explosion, both of the prevalence or the number of people that are vaping. But I think we all started to pay attention in early 2019 when the EVALI outbreak in the US came to attention. So these were individuals that had vaping-induced lung injury. And on the left-hand side here is a normal CT scan that we might see. And this is what we were seeing in those EVALI patients. So this was from the New England Journal article that described the case series of the first few patients that were presenting with this vaping-associated lung injury. And it was quite remarkable the extent of the lung damage that was observed over relatively short exposure times. Now, the exact exposure, as I mentioned, there are a lot of chemicals contained in these vaping products, and many individuals also modify their vape products and add substances. And so there's some evidence that this initial outbreak was associated with a single chemical or exposure that was common in these individuals. But that's not to say that that's the only reason why these individuals had vaping injury. Later on in Canada, there was a reported case of popcorn lung. And popcorn lung is another way of describing it being bronchiolitis obliterans. And in lay language, or in simple terms, that's damage to the very small airways of the lungs. It's that repeated scarring, which ends up closing the smallest airways closest to the alveolar sacs. And popcorn lung was described in popcorn factory workers who were getting sick due to their exposure at work. The chemical that was responsible for these individuals was diacetyl. It's a food additive that we add to make popcorn taste good. And when I present to young children, I say that doesn't mean you shouldn't eat popcorn. That doesn't mean that these chemicals are bad for you, because these chemicals have been approved to be digested. So they're safe to eat, but repeated and prolonged exposure of aerosolized diacetyl is what was responsible for the factory workers to have their bronchiolitis obliterans. And subsequently, there are very stringent occupational safety hazard standards to prevent bronchiolitis obliterans in factory workers. They have to wear N95 masks. There's lots of monitoring of their lung health to ensure their safety. And diacetyl is very commonly added to e-liquids. And when these liquids are vaporized, they have the same result of vaporizing or aerosolizing that diacetyl, which is very similar to what was happening in the cases of popcorn lung. Now, what happens on a population level? What have we observed so far? Again, the studies are being published almost monthly, showing that when you ask people who vape about their respiratory symptoms, they report irritation, they report increased cough, increased sputum production. They certainly are people who are vaping have reported greater visits to the emergency room because of breathing problems. And the other thing that we know is that people who live with lung disease, particularly adolescents with asthma, we have vaping devices that are designed specifically to look like puffers. And those individuals who already have a pre-existing lung condition, these conditions are exacerbated with their exposure to vaping. And so we see people with asthma with much more frequent hospital visits and admissions with vaping. I'm talking about the lungs specifically, but if you look in the cardiovascular research, if you look in other symptoms, we see that vaping is reported to affect all areas of the bodily functions, with the lungs being particularly sensitive. And so we know all of this, and you saw the advertisements that are being displayed across social media to advertise for people to use vapes. And this is what we have. We have Health Canada advertising. These I found on the internet. I have to admit, I have not seen any of these out in public. My colleagues at Lungs Nova Scotia PEI, we're trying. The Lung Association. But, you know, we really don't have the resources to compete with the advertising that we see in social media. And I think that's where, as lung associations, as lung researchers, as a collective community, we can do better. In 2000, CIHR, our major funding agency here in Canada, funded a series of Catalyst grants to really figure out what's going on with vaping. And then a couple of years later, they had a consultation to understand what's happening. And of course, these grants were funded just at the beginning of the pandemic. So it was very difficult to do lung health research at all during any research at all, let alone getting people to do breathing tests and other in-person visits. It was also extremely difficult to keep up with the rapid evolvement of the devices. I can share in our research, we started with some pictures of vaping devices. We thought if we knew the device that people used, if we knew the type of pods that they were using for the e-liquids, then we would be able to better understand exactly what was being consumed and whether there were effects specific to those products. And by the time we got research ethics and started recruiting people, none of the devices that we had in our pictures were being used anymore. They were almost entirely replaced with new devices. We talked about pods, and we wanted to exclusively look at people who bought pods. And so we knew what was inside those liquids, but they couldn't modify those liquids at all. And then we found out that actually pods are very expensive, and people would buy liquids and then refill their pods, even though they were meant to be non-refillable. And so not only here in Nova Scotia with our study, but across Canada, what we were seeing is challenges in conducting these studies. Many youth, when we've talked to them, they don't want to know the effects of vaping. They may be interested in participating in studies, but they don't want to know their results, and they don't necessarily want to be part of studies. I was told that we should conduct their studies and tell them that we're just studying lung health, that we're just studying health, and not to tell them that it's specifically about vaping. As you know, vaping is illegal in young adults. You have to be 19 in many provinces to buy these products. And so high school students don't want to admit that they're vaping because they're not meant to be having access to these, and they worry about getting in trouble or being identified as vaping. I'll show you some work. Nova Scotia was leading the way in banning flavored e-cigarettes or the flavored liquids, but what we see is that people are still getting these. Our borders are porous, and even though we have the ability to conduct this research, it's really difficult to keep up with what's happening. So I mentioned, I don't think we can wait 40 years, 20 years, even 10 years to determine if vaping is equivocally safe. I think we have to take the evidence that exists and think about what we know and how we can maybe extrapolate that evidence or use it to better communicate with individuals what the risks are. Just like smoking, just like alcohol, it's legal here in Canada to vape at the moment. And so I think our goal should be to provide the education and the resources so people can make informed decisions. Because right now our perception that vaping is safer is a problem. So my work, as Barb mentioned at the introduction, is thinking about how the lungs work and function and how lungs grow and develop across the life course. And I've worked a lot with people who live with lung disease. And so in my research, we've tried to identify, how do we measure the earliest signs of lung disease? How do we know when disease is progressing so that we can intervene and slow the progression of lung disease at the earliest possible moment? The tests that we have in many hospitals and clinics today measure the large airways. By the time the large airways are damaged, the damage is permanent. And so my research focuses on measuring lung disease in the small airways. We want to be able to detect disease as early as we can. And in young children with cystic fibrosis, the tests that we work with can detect lung disease nearly 10 years before some of the more traditional tests. There's some work across Canada, but particularly, Barb, I see you, I'm getting there. Some work in London, Ontario, looking at xenon MRI. Again, you don't have to be a doctor. On the left, healthy lungs, where all of the air is getting to every single part of the airways. And on the right-hand side, an individual with significant lung damage due to vaping. This is one individual. This is very clear lung damage that we're observing, but we need to understand whether this is happening to everyone who vapes. And so that's what we're doing here at Dalhousie. We're, I would say, halfway through. We're nearly there, and I'll share some preliminary results. What we're trying to measure is that ventilation of the airways to see how efficiently the lungs are working, and if we can start to detect that early lung damage in the small airways. This is our team doing the test. It's a very easy test to do. You breathe 100% oxygen, and we see how long it takes you to wash out the nitrogen in your lungs. It's a very safe and easy test to do. It takes about half an hour to 40 minutes to do the test completely. And this is just some of the signals that we see for those of you that are interested in the physiology. So we're looking for 50 people who exclusively vape and 50 healthy controls. And I just want to, I'm going to skip through this so that I can get to the exciting part. So these are some of our very preliminary results. I can share with you that people on the healthy side aren't necessarily healthy. That's been one of the biggest challenges that we've come across. My research assistant came to me and said, but Sanja, they lied to me. They said they weren't smokers to get their $20 gift certificate. So we're having some issues in terms of labeling our healthy and our vaping group. And if you can see here, again, this is very preliminary, unpublished data, but we're starting to see these groups separate. Very clearly, there are some individuals who vape who have this lung clearance index, what we're measuring of the small airways, that's elevated compared to their healthy controls. A shameless plug, if you know anyone in Nova Scotia between the ages of 18 and 24, please tell them about our study. So I'll end so Barb doesn't get mad at me. We have evidence that's accumulating, whether it's cellular, animal, from questionnaires and hospital admissions. We can start to measure that vaping is causing respiratory problems in people. But this research is exceedingly difficult to conduct because what people are consuming is difficult to measure. Many people are reluctant to participate, and finding that comparator group is very difficult. So I don't think we should wait for the definitive evidence to take action. And I think the continued work in this area will certainly show us what's happening in the lungs of people who vape. very grateful to Research Nova Scotia and the CRISM Network for funding this research, and my team here who does all the hard work to get these results. And I'll stop there and take any questions.
Thank you, Sonia. Did you feel that big hook coming off the side of the screen?
I got
Like
it.
in the old days?
Barbara, I'm like, uh-oh, 2 times. I'm definitely gonna get in trouble. The music is gonna start playing. She's gonna get me off the stage.
No. So we have a few minutes. We're going into a 5-minute break anyway. So if anybody has questions, please take the time now. And as I said, at 9:30, there will be a 5-minute break. It was an excellent topic. So we'll see. There's a question, I believe, there. Can you see that in the Q&A?
Yeah. So there's a question there from Carolyn. Hi, Carolyn. About secondhand vape exposure. So I am aware of one study that was published around Christmas time this year. It was published in Thorax, and it shows that, yes, there are at least the symptomatic effects. So individuals who don't vape themselves but live in a household with people who vape have reported increased cough, sputum. Again, people with respiratory diseases who are exposed, being exposed to increased hospital admissions. And so there's only one study that I'm aware of right now, but it certainly showed that there are secondhand effects. I've also heard of something called third-hand effects. So when people vape, obviously the aerosolized liquids and air goes into the lungs, but when they blow it out, or even the peripheral aerosolized chemicals tend to land on surfaces. We've heard parents talk about their children vaping inside their cars and that they can't scrape off the gunk from their windshields to see in the winters. And we've also heard that children who touch the surfaces where these vaping residues fall, if children then put their hands in their mouth, that there's children who have reported vomiting, nausea, who have ended up in hospital because of that contact with the residuals on surfaces. So about getting in touch for bringing this to schools. So I'm keen. This information, I'm happy to share my slides. I know we've been chatting at the Lungs Nova Scotia PEI about getting into the schools. What's interesting, I've done a couple community sessions and I've asked them, like, do you hear about vaping? Do they tell you any of this information? And resoundingly, people say no, that they hear about smoking when they're younger in junior schools. They hear about drunk driving when they're in high school, but that there isn't a lot of information about vaping or the effects of vaping. When we've consulted with our teenage informants, I call them, and I've said, like, when should we tell you this information? And they all tell me that by high school, it's too late. When children get to grade 9, it's kind of a social norm and it's everywhere. That really we need to start younger. I've heard reports of 10-year-olds vaping, and vaping being now very common in middle schools. And so, we have some programs in PEI that have been effective in schools, and I think that we can try to bring that all forward.
I just want to remind people we are into the break time, which will end at 9:35 when our next speaker will come on. Certainly, if you want to use this break time to ask a few more questions, or we can certainly provide Sonia's email contact.
Yeah, absolutely. Yeah.
You can always email me at barbara.walls@nblung.ca for that information. Of course, now there's like 5 questions.
Now there's lots, and I'm looking about allergies, dust particles that contributes. Not aware. Certainly, we have a lot of evidence about allergens and dust particles, especially in young children, and how those contribute to the development of allergies and lung disease. I haven't seen any how that together with vaping works. There's vaping versus lung senescence. So again, there are a couple, they're all preliminary data and studies where we've taken some samples from lung tissue and people having lung surgery for other reasons. And we're just starting to study those cellular mechanisms and what's happening. And so really important.